at this critical period to have a single dose vaccine. One, because of the compliance rate. Before we had 2 doses, and it was a bit difficult that somebody will get the first dose and may not get second dose. There are many people who had the opportunity to take their first dose, but then they don't have the second dose. And having first dose will only make you partially immune, which will mean that you are still more susceptible compared to somebody who has taken the 2 doses. So that is one of the advantages of having a single dose, because once I take it, I don't have to come back. I mean, our center at KCCR is one of the centers in Oforikrom that is vaccinating. And since they started last Saturday, I have looked at the numbers, and it's very encouraging. There are a huge number of people that are so eager and are willing to take the vaccine. And as of yesterday, they couldn't even contain the numbers and get to the afternoon. So the eagerness is there. And people are quite excited because people know that the vaccines are working. The other good thing is that, I mean, this vaccine has also some very good efficacy rates. You're looking at numbers like close to 90% efficacy against hospitalization and critical deaths. And then also after taking the vaccine, you expect that within 14 days, you should also have mounted the highest antibody titer level. So it's also one advantage that I also feel that if we are able to give this to many people as possible, we'll be able to reduce the impact of this third wave that we are having, which will mean that in 2 weeks' time, many more people are likely to attain the highest antibody titer, and therefore, in a month's time, we can already predict that we are likely to have a reduction in cases for some hotspots. I also remember that the vaccines are targeted at the hotspot, which is very good. So in Ashanti region, in Bono, in Greater Accra, which are driving the numbers, if you have more of them vaccinated, you have a chance of at least succeeding in reducing the active cases. In terms of